Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by your friends at OnLife. We would like to remind you that the Q&A feature is available, so feel free to send in your questions for our speakers throughout the discussion. And with that, I will turn it over to our moderator who joins us from GuideWell Venture Group, Mark McConnell.
Good afternoon, and welcome to our session, which is entitled Follow the Money, Venture Capital and the Future of Healthcare. I am Mark McConnell, and I'm going to be your moderator today. And as was mentioned, I lead the GuideWell Venture Group and also have the privilege of being the CEO of one of our portfolio companies called Untitled Health. At OnLife, we believe that what consumers are looking for is not just more information, but clarity. Not just a lot more choices, but really specific guidance and direction. So our health and well-being platform simplifies that healthcare experience and provides a very individualized and relevant wellness journey that is streamlined into a series of very simple actions for the members, which we call the next right thing to do. And that guidance is individualized and customized to generate better outcomes and better engagement. I'm joined on the virtual stage today by three very esteemed and accomplished panelists. We have Haley Hovius, Walter Jin, and Sally Ann Frank. So before we start with questions for the panel, I'll hand it over to each of them to briefly introduce themselves. And then after the introduction, my very first question will allow each of them to go into a little bit more depth on their specific organization. So Haley, let's start with you.
Thanks, Mark, and thank you so much for having me today. It's really exciting to be here. My background is that I was the president of the National Healthcare Council for about 7 years, and that was an organization that connected and educated Nashville's healthcare industry, which was hugely provider-focused to a great extent, although the council made sure to connect and educate everyone within the industry and didn't have any major focus in terms of where we put our efforts. Now I really focus at Echo Health Ventures on looking at payers and trying to help them make the best possible investments that they can in innovation. Echo invests on behalf of 4 Blue Cross Blue Shield plans across the country: Cambia, Blue Cross Blue Shield North Carolina, Arkansas Blue Cross Blue Shield, and Blue Cross Blue Shield of Tennessee. And it's really exciting to have that lens these days that we're investing through. So thank you for having me.
Sure thing. Thanks, Haley. Sally?
Hi, everyone, and thank you for having me as well. So I lead the Health and Life Sciences vertical for Microsoft for Startups. And so what I do is I set our strategy, programs, and portfolio for health and life sciences within the startup organization. And I've been enrolled for about 2 years, which is how long our industry focus within the program has been around. Prior to that, I was involved in IoT within healthcare, and so have a real love for anything medically device oriented, from wearables all the way to the expanded and large systems that we use to diagnose and treat. So it's a pleasure to be here, and I'm looking forward to the conversation.
Thanks, Sally. And last but not least, Walter.
Thanks, Mark. And also Echo, thank you for the invitation to have me on this panel to be with Haley and Sally. Even though I'm not on the investment side anymore, I guess I can still contribute some insights from the perspective of being an operator now. So I'm currently Chairman and CEO of Pager, which plays in the care navigation, virtual care management space. I'm sure we'll talk a little bit more about that in a second. But most people, I guess, know me from my background, 25 years in private equity and venture. I was a general partner at Three Fields Capital, focused on growth equity investments in healthcare. And prior to that, I was the co-head of healthcare at the Carlyle Group, where we did buyouts, venture, debt investments across US, Europe, Asia. Thanks for having me.
Yeah, sounds good. And just to follow up on that, Walter, with your company Pager, as you mentioned, definitely helping consumers navigate their entire care journey. Tell us a little bit more about Pager and give us your perspective about care navigation in general and how companies like that will impact healthcare in the future.
Yeah, as I said, Pager plays in that space on care navigation, virtual care, and care management. I kind of try to go by the find care, get care, aftercare regime for where we play. And we're really addressing healthcare's most basic fundamental problems around access, because healthcare is very complicated. It's very complex. We really cannot and should not be self-diagnosing ourselves. So a lot of the technologies that are out there today that deal with what I'll call self-service mobile apps or digital platforms are very challenged because people just don't know really what to click. And so that, coupled with the fragmentation that exists not only physically, but there's now virtual fragmentation because there's 100,000 healthcare apps in the App Store. So really no one knows what to download when they're using it once in a blue moon. And the last piece of the problem is, I think, is the friction. It's just hard to do everything. We don't have open table for healthcare yet. So that complexity, that fragmentation, that friction is really addressed through our tech and services platform that I can simply sum up the inspiration behind, which came from my relationship with my brother, who is a ER doc at Kaiser. So I have a doctor in the family. And for those of you that have that privilege, you know what that experience is like in healthcare. It's actually quite easy. It's a trusted, personalized experience. And the issue is that not everyone has that. From a health equity perspective, our mission is really to deliver that for the 99% at scale. And so what we do is provide that through technology and services, that advocate, that guide to help navigate people throughout the healthcare system to get them access to the right care, right place, right time, on demand. And then very importantly, what I call aftercare, follow up with people after that visit. When you think about a lot of point solutions out there, it's very transactional. And then once you're done with, let's say, telemedicine, if there's any follow-up, no one reaches out to you. And if you have a question, you can't reach back out to them. And so we really have a continuous end-to-end flow in our solution. And that's really generated a tremendous patient experience. Our Net Promoter Score has been in the high 80s for over 5 years now, and tremendous utilization on the platform because it is really an end-to-end ecosystem that involves not just nurses and doctors, but pharmacy, customer service, care management, SDOH, just really a lot of the components of healthcare stitched together so that it's a connected care experience.
Perfect. Thanks, Walter. And so, Sally, given your role at Microsoft, you obviously see a lot of great young companies. Can you give us a little bit of an overview on what you guys see happening in the world of healthcare startups right now?
Sure. And I think we can start with the fact that we saw 2021 being a huge year for health tech investment. And not surprisingly, we're starting to see some of that activity drop a little bit. But I think the momentum and the desire to continue to evolve our healthcare system is still there. I'll talk in terms of both a business side and a technical side. I'm a business leader and technologist with a passion for healthcare. So I kind of look through both of these lenses. In addition to some drop in the investments, we're also seeing some of the larger startups, some of the more mature ones, actually having to lay off folks. And I think that's really sad. And I know we all hate to see that. But in some cases, it may be a right sizing. It may be, folks were a little bit too bullish based on how things happened in 2020 and 2021 as we look toward technology to help us deal with some of the issues during the pandemic. But what we're seeing as far as solutions that are coming into the market that are really succeeding from the startup space are things that help with dealing with the staff shortage, things that help with health equity, things that help with mental health. The two areas, health equity and mental health, that I really think came to the fore over the last couple of years because of what we saw. We're also seeing, and I think this is a change in kind of the model around innovation in healthcare, is seeing providers, payers, and pharmaceutical companies actually launch their own funds, their own accelerators, because they want to have a greater say and a greater impact on how healthcare evolves. So that's kind of on the business side. I mean, I think about Kids X, and they've got that's an accelerator with 38 pediatric organizations, hospitals, banding together so that they can affect how innovation is handled and done within the pediatric space. So then on the technology side, I think we are beginning to see kind of an uptick finally in cloud adoption across payers and providers and pharmaceutical companies. They were a little bit more forthcoming. And because of that, we still need to focus on interoperability. We still need to focus on privacy and security. And then the other areas that are growing in leaps and bounds, of course, are artificial intelligence, machine learning, RPA, deep learning, the metaverse. I mean, all that great stuff.
Sounds good. Thank you. And speaking of artificial intelligence, Haley, AI and machine learning are really two of the big buzzwords we hear a lot and have heard a lot for a while now. Your company, Echo Health Ventures, is investing in a pretty wide range of healthcare companies. How are the companies in your portfolio using those technologies?
Yeah, I think that's a great question. AI, in fact, from 2020 to 2021, saw about 108% increase in investment, and about 20% of that was devoted to healthcare. So it's a really big increase, and I think it's gotten to the point now where we're seeing it as it's more of a tool that, as you say, our companies are using, and I think it's starting to be very widely accepted that there are a lot of really great use cases for this, but you have to be solving the problems that exist in healthcare, and this is another tool to do that. From the Echo standpoint, investing on behalf of these 4 Blues plans it's really important to us. We're actually really measured on not just our ability to make a financial return, but also on the strategic impact that we have in the organizations that we serve. And from that standpoint, we are hyper focused on solving the problems that exist for these health plans. And so when we talk about investing in companies, we're talking about the companies that actually have the sort of solutions that we need, and they're using AI and they're using machine learning to do that. We have a company called Octave. Octave is working in the MS space, a really complex disease state that is very difficult to manage, very high cost. They're using the AI when it comes to looking at radiology scans, but that's only a piece of the puzzle that they're solving, because they really do wraparound care services for this entire population of people. So it really is a tool within that. And I think that we're seeing that more and more, whether it's people's ability to connect with patients differently. And certainly on the care side, I think, over the past 2 years, we've seen AI being used in a lot of settings in order to enable better opportunities for people to receive care in the home, and to be able to do that in different types of settings, and to monitor patients differently than we have before. Also helping, I think, in some sense with what Sally mentioned in terms of staffing. So from our perspective, it really is all about solving those problems, whether it's the cost of care and reducing that, and whether it's managing patient care better for better outcomes. And I think that's kind of where we are with it at this point. So.
Sounds good. So I've got a couple of more general questions for the panel. And after I ask the question, I'll ask one of you guys to start the conversation, and then obviously the others can jump in and follow. So let's start with a really quick overview of where the healthcare market is today. As Sally mentioned earlier, the health tech company investments have increased really significantly in the past few years, especially in 2020 and 2021. Of late, maybe there are some additional risk factors that have inserted themselves, things like inflation or perhaps the war in Ukraine. And they've created maybe some concerns in the investment community. Given that uncertainty, and this question is for Walter first, what are the programs, services, and technologies that the major players are still investing in today? And what kind of deals are getting done in this environment?
In addition to the situation in Ukraine and the other things, I mean, the stagflationary environment, I think, is also causing tremendous risk as of late. I think that's the real question of what deals are getting done. In terms of the themes, I haven't seen a difference that was a market shift in the themes of things that are attractive to the investment community. Some of the things that Haley and Sally already mentioned on the AI ML side. A second generation version of virtual care beyond telemedicine, value-based care, I think, is still a very worthwhile and sought after thing. RPM, I mean, there's a lot of similar themes that I think people are continue to be focused on, because they're going to be monumental transformative shifts in the healthcare ecosystem. But the real question to me is what deals are getting done. And I'm sure it's, common knowledge of the audience, but everyone has pulled back significantly. And the threshold and the bar for investments has gotten exceedingly higher because naturally the risk is so much higher right now, even though the market's gone through a little bit of recovery. No one really knows if it's sustainable or not. And we just need to see the print on real economic data on inflation and growth and unemployment. Everyone forgets the Fed has a dual mandate, not just inflation, but full employment. So I see clearly a shift towards, bigger companies and funding bigger companies, more established companies, companies that are growing exceedingly at a high rate. And those startups that, are slower adoption, slower traction. There are lots of talks of exits and fire sale assets and a lot of brewing M&A activity because the prospect of where they're going to go is unclear. And if you think about it from a fund perspective, you have a certain amount of capital in your fund. You cannot possibly fund all your portfolio companies to cash flow break even. And that's exactly what happened in 2008, if you remember. And so some choices had to be made where they had to pick and choose among the portfolio. And that's a really tough thing to do. I don't know if it's gone that dire because 2008 obviously was a financially driven crisis. And the capital markets are not frozen by any stretch of the imagination. Funds are continuing to raise capital and capital is continuing to flow and get deployed. It's just really where it's getting deployed and what companies. And so the result of all that kind of uncertainty, if you're now on the company side of the end, is to pull back cash spending. So you're seeing the hiring freezes, you're seeing even the RIFs, and not just in our world of startups or growth equity, but even the big tech companies obviously has hit a lot of newsprints for layoffs and requests to increase productivity. So I think there's a lot of just uncertainty that's causing people to be cautious, not only on the investment side, but how they operate with respect to cash. But I'm not sure I'm seeing a lot of difference as it relates to the themes. I think they're still worthwhile and worthy themes that will continue to get investment. It's just a matter of which ones are going to get that investment.
Makes sense. Sally or Haley, anything to add to that?
I think we both could add to that, and probably both will. I would agree with what Walter's saying. I don't think that certainly as we look at it from ECHO's standpoint, looking to solve very specific problems for payers, we're not seeing a change in what we're investing in. With some slight, I mean, there might be a bit more of an emphasis on how you reduce costs in healthcare, and so any opportunities we have to see that, maybe we're just taking a look at a lot more of that. So high cost disease states, how you would lower those costs, that's becoming more and more important to plans. And also being mindful that the plans themselves are working with physician groups that are under a lot of pressure right now too. You're seeing physician groups start talking about unionizing. Physicians in certain areas are being paid less than nurses, which is an intriguing state of the world that we're in. So with that in mind, we're also having to come up with solutions that make sure to integrate really well with providers and making sure that it's not actually taking work away from the providers or in any way upsetting those relationships. I would also say that there's been a lot of making sure that portfolio companies have the cash they need to withstand the next 3 years, and to, as they're tightening their belts, also making sure that they're going to have what they need in reserves to get through this time period, just in the case that they're going to need it. And that's, we've seen that for the most part. I mean, each of the portfolio companies I know that is in different states of being. A lot of follow-on investments though, from first round investors and that kind of thing. Not a lot of rounds have been opening up at this point. I will say that's starting to change a little bit as we head into the fall. We're starting to see more deals coming through. Obviously nowhere near last year. And I don't know how much that situation will change, except that there is some pickup on deal flow. And I think that, it's going to be the story that no one likes to hear really, which is, if you've already run some successful teams and have success in the past, you're more likely to get the investments that you need moving forward. So not that that's going to surprise anyone, but I think that's what we're seeing.
Yeah, just to add to that, I think, if you had gone back to say January of 2021, people might be investing in things that look more like Horizon 3. And I think folks are now saying, I need more immediate return on my investment, whether it's an organization, a VC that's making an investment in a startup, or a payer or provider who is interested in doing a pilot project with a startup. They want to see, ROI, or in some cases, an increase in revenues because of a new business model that they're able to introduce based on the technology. So I think it's the areas of innovation and funding are probably very, very similar. But I think the desire to have outcomes faster are probably making the difference in at least some of the investments being made.
Yeah, makes sense. And so kind of related to that conversation, and I think we covered some of this, but are there any companies that have positioned themselves, as you guys see the market right now, to really excel and expand in this time of uncertainty, and maybe also touch on, if you can, the current operating environment that exists today in the market? And if you want, Haley, we can start with you and then go to Sally and Walter.
Yeah, I think that, we are seeing companies that are really well positioned for this. Again, companies that have been led well and do not have a high burn rate right now are looking pretty good moving ahead. And companies that are doing work, like I mentioned earlier, in areas where you're seeing high cost savings. We're seeing a lot in pharmacy right now. Specialty pharma is still a huge spend, still really interesting. We're seeing some really interesting solutions coming out of there. I think those companies are going to be well positioned. Again, anything that's going to reduce costs is going to be super helpful as we move ahead in the coming weeks and months to move things forward. And particularly if they have a management team that's done this before, I think they're going to be in a better place overall. At least that's from where we're seeing. That's where a lot of emphasis is going.
Other comments?
Mark, do you want me to name names?
Go right ahead.
Okay, I didn't know how much in the weeds you wanted to get, but I've got a couple that I work with that I think are really poised to have an impact and grow big. So one of them is Recurro Health. And interestingly, they do everything from virtual health to genomics and home testing. And so they've taken that virtual health or telehealth model and expanded it through kind of the patient journey. But not only that, to Haley's point, it is a well-seasoned team. They've grown through acquisition. And they, when I first started talking to them, I assumed they were like going to partner with other healthcare providers, kind of brick and mortar healthcare providers. But actually what they're doing is they are going after self-insured employers. And so this becomes a much more holistic way to reduce costs for those major employers. So I think that's an interesting model, and certainly not one that I originally expected when I started talking to them. Another one, and I'll kind of bolt on to what Haley was talking about regarding specialty pharmacy. We have another startup called RX Lightning that is automating that whole process of specialty medications. And so where, you've been diagnosed with a cancer and you wait several weeks, sometimes months for your oncology drugs, they are streamlining that process and working both sides, both from the provider side and from the pharmacy side, and just streamlining that to, a matter of days or weeks as opposed to weeks and months. So they are also poised and in a really good position because they're streamlining something and reducing the time to value and reducing costs for all the machinations that go into specialty medication, prescription and management.
Walter, any thoughts?
Mark, I could be very self-serving and say pagers are great one to look after. I mean, we have been growing at a very fast pace and have quite a bit of cash in our balance sheet that could bridge us to profitability. So I think we find ourselves in a really fortunate space position, which which I'm really thankful for. But if I were to name in a non-self-serving way, actually this is self-serving because our family offices invest in these companies, but maybe some companies that I'm not invested in personally. I think Clarify Health is an exceptional company. Dispatch Health, I think, is an exceptional company. I mean, there's a ton of them, but I'm just trying not to be self-serving. But Pager clearly.
And Walter, I want to be self-serving too, but you mentioned Dispatch Health. That is an Echo portfolio company.
It is.
And it is doing brilliantly because it is lowering the cost of care. It's keeping care outside of the hospital. It's before they even get to an emergency room, it's being able to keep people in their homes. So I would echo that as a really great one that we're really excited to see where it goes. Yeah, definitely.
Well, it'd be really hard to have the conversation that we're having today with the title we have without at least bringing up a big piece of news that's dominated a lot of the market lately, and that was the Amazon One Medical deal. And so on the surface, there's a number of potential benefits. Obviously, the marriage of the virtual first with a more brick and mortar to be more vertically integrated. Not without challenges, obviously, that could present themselves down the road. And certainly, there have been other firms that have tried this and some have been successful and some haven't. How do you guys see this deal and how do you see this impacting the delivery of specifically primary care going forward? Sally Ann, do you mind starting and then we'll go to Walter and Haley?
Sure. So I just want to say before I get started, so Microsoft does compete with Amazon Web Services. And so I'm going to preface this by saying I'm going to try and not present my biased opinion, but in fact, kind of synthesize what I've been reading and hearing in the press and from industry pundits. So let's start with One Medical. So One Medical has about 200 sites. My understanding is that they have about 760,000 patients within that organization, but they're also not profitable. And that's an interesting twist to all of this. Now, there are kind of pros and cons, and we'll talk, I'm sure, in detail about all this. But from the pro side, I think there is an opportunity to change the model of patient care, all the way from like Band-Aids to wearables to in-person care with a primary provider. And I also think that there's an opportunity for some of these smaller providers that are struggling with staffing shortages to kind of lean on this ecosystem to help them serve their patients in a meaningful way. But on the other side of things, and the last part of this that is good is how do they leverage Whole Foods, how they leverage PillPack. You mentioned the whole vertical integration, which could be really interesting and really huge. Some of the challenges that remain unsolved are things like data security and privacy, reimbursement. Are you going to end up getting, when you log on to your Amazon Prime account, are they going to tell you to get, Metamucil because you went to the doctor and you've got some issues? I mean, there's a whole host of where the lines get drawn to make sure that we don't end up with a Skynet type of scenario for healthcare. But I do think there's lots of promise there. I would hope that they succeed and really move the needle on patient care, but it remains to be seen. And I'm curious to see what Haley and Walter think as well.
Mark, I can go next. I'll give the same disclaimer that Sally gave. One Medical is a Carlyle portfolio company. I don't have any confidential information about the business, but my perspective on One Medical is it is solving maybe access for extremely low acuity cases. So if I'm CVS Minute Clinic or maybe plain vanilla telemedicine, I think you might be worried. But the issue with One Medical or any other kind of new bricks and mortar healthcare delivery system is what Sally mentioned on the supply chain problem of the shortage of clinicians. There's a shortage of doctors. There's been a shortage of nurses for decades. That has not changed. Just because you put up a new clinic doesn't mean you've solved that problem with access. You're stealing from one bucket and putting it in your bucket. And as a matter of fact, I think most of the One Medical doctors are, just out of residency. So I've always been warned by my brother that if you're going to go see a doctor, don't see someone that's so old that they're not up to date with new technology, and don't see someone super new that they just got out of residency and they don't have the experience. And I think One Medical gears towards the earlier part of that spectrum. So what Amazon's going to do with that asset from the consumerization of healthcare and an easy button, I think will be great to be able to get on-demand access, but it's going to be really for low acuity cases. So when you think about the $4 trillion spend we have in this country every year, it's going to have an impact, but it's not going to get to the 80% where a majority of the healthcare spend is being consumed for very medically complex cases. So I guess that's kind of my play. It's really more winners and losers on the low acuity space, but no impact on more complex cases in healthcare.
Makes sense. Haley, any thoughts?
I mean, Walter mentioned sort of consumerization of healthcare. I came from consumer packaged goods marketing back in the day. I miss having as much data as boy we had, and I think that's one thing that will be great is for consumers who can't access Walmart, who can't access Amazon and One Medical, that they'll have really great opportunities to have a company that's very focused and understands what consumers are looking for. Although I would say that Amazon doesn't necessarily understand healthcare as well, which is a problem for them. And I think this acquisition of One Medical, hopefully they'll be able to learn about the actual provision of care from that in a real meaningful way. I would agree, though, I don't think, apart from the fact that I think it'll be great for some consumers to have this influence in healthcare, I don't know that I think it's going to have a major impact. I don't know if and how they plan to work with Iora. I think One Medical had just purchased Iora. That was going to be more of a Medicaid population. I don't know if they'll still plan to serve those people. The margins would be very different. I don't know if it's the business model they're looking for. So when it comes to making a huge impact on healthcare at large, I just don't see that it'll be as big an impact. But for those of us that can afford it and will have the ease of being able to see a doctor and get a prescription right off the bat in the next hour, I think that's a marvelous thing. But again, they're competing, to Walter's point, with low acuity and people that can likely afford it, is my guess.
Makes sense. So shifting gears just slightly, there's been a pretty strong push to take in-home care pretty mainstream, and it's been across national organizations, small startups. How is this sector shaping up in terms of the different care models? There's in-person, obviously, versus virtual, and there's different intervention personnel all the way from medical doctors to cross-section of care teams. Do you guys see this evolving further? And if so, how do you see that particular sector shaping? And Walter, I'll start with you, and then we'll go to Haley and Sally.
Yeah, I think there's clearly a shift. I'd say the digital health first wave, past 10 years, has really been geared more towards point solutions. That again contributes to the fragmentation and the experience of a fragmented experience rather than unifying what is already a disjointed ecosystem. So when we think about care models, if you think about a multi-specialty practice, there's this collaboration, a care team approach to your question, and there's been a lot of talk in the industry about the need for a true platform. Let's say a 360 platform, which Pager has a 360 platform, and the concept really is to create a collaboration. Using our technology, we can bring in a collaboration team virtually of nurses, doctors, pharmacists, customer service folks, just a range of different folks to really provide that collaboration for that patient, for that employee, for that member, so that they don't have to download 20 different apps. They're probably going to be a handful of dominant apps going forward in the digital healthcare space. And my bet is it's going to be the people that already have the market share today. So whoever has the brand today, for example, big payers, the three big nationals, Blue Cross Blue Shield, these folks have over 50% market share, near monopolistic market share in their states, and big health systems that are very, very large entities of market share in their zip codes, and big employers that really are, the largest employers in the state. They will continue to have that market share, and I think they will continue to dominate the eyeballs. And so the question really is then, once you have that market share and that distribution pipeline, what do you do? How do you get utilization and volume and value to really go through that pipeline? And that's kind of where I think platforms that deliver that care model, which is in Pedro's case, virtual predominantly, but we recognize the need for bricks and mortar from time to time when it's clinically appropriate. So we do refer quite heavily into the brick and mortar space in partnership with specific providers. And in case, where care should be handled at the home, companies like Dispatch Health, for example, nice plug again, Haley, would, that ecosystem where if you think about it, I think about Pager and companies like us as a virtual care wrapper, right? It's not that everything happens in the virtual world from a care model perspective. We're kind of a wrapper around what already exists. So we do have physical infrastructure that's necessary. People need to do procedures in person, and it's great to also treat you at the home. So whether you're in the provider clinic setting, you're in the home setting, Pager can be that third setting, which is virtual, that's a wrapper around all of that. And that kind of creates that continuous flow from a collaboration standpoint, so that's less fragmentation, if that makes sense.
Haley, any thoughts?
I would say definitely I would bring up Dispatch there as well. So Walter, thank you for continuing to plug that. One thing that's great though, and I think that we're more and more seeing, is that it's not really as much like with AI and machine learning, it's not really telemedicine anymore. Telemedicine is merely a part of the care pathway and the care journey for a patient, and it needs to be utilized when it's appropriate. And we're starting to get much better, I think, post-pandemic about utilizing it very much appropriately. At Echo, one of the things I mentioned earlier is that we really take great care when looking at the different point solutions we have to make sure that they integrate well with providers, and that is a big key to what we're doing. We're not really doing much when it comes to just a straight consumer play that's not integrated. Walter, to your point about how Pager integrates with doctors, whether we're looking at MSK, and Echo made an investment in a company called Vori that works really closely with the actual physical therapists and the doctors who are providing that care as well, to make sure that everyone's aligned, and so that anything that's done virtually contributes to overall, and that these are opportunities. Heartbeat Health is another one. Again, it's allowing for monitoring of patients and cardiology in that space, but again, very much integrated with the cardiologists themselves and what they're actually doing. And Dispatch is the same. It has a deep integration as well with primary care providers post-episodic. So I think those are pieces of this. And now that we're starting to be able to create something that for patients actually makes a lot of sense in terms of wrapping care around them, whether it's with physicians or whatever extender network they need as well. And there are more and more solutions coming out that I think are really taking advantage of this, and certainly that we're seeing. So that's great for patients.
Makes sense. Sally, anything to add?
I don't think so. I think they kind of covered it. That was really good.
No problem. So I have a few questions that'll be more of a jump in and give a quick thought on it. We do have a fair amount of questions in the Q&A that I want to make sure that we get a chance to address as well. So there are a lot of different areas that are ripe for innovation, and you can look at it from a bunch of different perspectives. But from a use case perspective, does anybody have thoughts on the top areas that you believe are ripe for innovation? And anybody can jump in.
Lightning round. I would say specialty pharma and pharma in general is one that just keeps coming up for people because it's so high cost.
I think we're also looking at diagnosis and therapeutics, and how do we use AI and machine learning to do better, quicker, faster, more accurate, less variable diagnoses, I think is another area that we're seeing a lot of work in.
Great. So we talked a lot about new technologies and some of the innovations that we're predicting. In particular, what do you guys see will be the impact specifically on health plans of some of these new technologies and innovation that we've talked about?
I'll chime in here. I think health plans have been at a crossroads, almost being disintermediated by some players that are going direct to employer, and from a relevance perspective, I think health plans are really fighting back with a very big charge of going back to their original thesis of, the HMO and real care management being managed care, if you remember that term from 20, 30 years ago. And so companies that are helping to transform the health plan to not just be a claims administrator or TPA, but really manage care. You're starting to see that change in philosophy and how they position themselves, and that's helped by some of the newer startups like Bright and Oscar Health and the like, that they don't position themselves as an insurance company, even though they are. And I think that transformation is going to continue. It's going to take time, but a lot of people don't think about going to a health plan first for care. They go to a provider first, but going to the provider first, you're already kind of lost in the ecosystem, and the access and navigation is extremely challenging. So a health plan has a 360 view of that picture, especially on the eligibility and benefit side, or self-insured employer for that matter. Really, any risk-bearing and true risk-bearing entity, I think, is going to continue to have like strong relevance in that perspective.
Any other thoughts?
I would echo, since we invest on behalf of these 4 plans, and we really integrate very deeply with them so that they view us in great part as part of their innovation strategy and part of their ability to adapt to future needs that they'll have, whether it's for their large employer groups that they're all working so hard to entice, or whether it's just to manage the difficult populations of people we have coming through at this point. Echo recently made an investment in a company called Embold, and Embold is really working to make sure that we're measuring providers and whether or not they're delivering care appropriately, so the right care at the right time, looking at their outcomes, and then finally looking at cost, allowing them, whether it's a large employer, they started out of Walmart, so whether it's a large employer like Walmart or some of the plans we work with, to be able to do a better job of steering patients to, and I know people hate the word steering, but being able to help patients understand where the providers who are delivering the best outcomes are. And I think that's something that's really exciting if you're a patient, much less if you're the payer.
Yeah, the only other thing I would add is I think these moves towards price transparency, towards payers getting involved in member wellness, and trying to build that relationship not based on an episodic or acute diagnosis, but actually going back toward, okay, you're healthy now. What can we do to keep you healthy? How can we influence your behaviors today so that we're not paying out some big claims later? And I think those are a couple of other areas that I'm seeing some movement in that are really intriguing.
Great. So one dynamic that goes on in healthcare, and it seems to be a cyclical thing, is that we migrate from what could be called a point solution or a best in breed strategy to more of a one-stop shop or a holistic approach when it comes to delivering vendor type solutions to populations. What is the investment market saying about this question? Is there a point of view on the best approach, or does it vary in cyclical ways like I just described? Anybody have thoughts on that?
I'll start, but I'm going to hand it off to Haley and Sally because they're the investors in the room here. But I will tell you, from a commercial market standpoint, employers and health plans and health systems are absolutely fed up with point solutions. I've heard that message loud and clear. I don't know if it's made its way to the investment community, so I'd ask Haley and Sally to chime in on that.
So ECHO does work with a group called EHRIR, the Employee Health Innovation Roundtable. And I think this was posed to them maybe 6 months ago. And it was kind of 50-50 actually on sort of if they still had appetite for point solutions or if they really wanted that platform solution. I will say from the plan side, the plans are getting really tired and feel like they need to be able to offer some sort of at least plug and play opportunity. You know, how do we make this easy for the people that we're working with to actually be able to integrate all of this? And I think, you know, if you're a consumer trying to deal with all of these opportunities you have to have point solutions, it's really exhausting. You've got people reaching out to you. I've got parents that are on Medicare at this point, and not only is it incredibly confusing, but they have people calling them all the time. And I don't think that's necessarily a platform versus it, but they're certainly not being managed very well because their doctors are calling them, their plans are calling them, Medicare, I mean, everyone's calling them all the time, and they find that, I think, quite exhausting. I think whatever we can do to simplify all these work streams for the consumer to make it so that health is a lot easier to understand and to access is all going to be important moving ahead. So to answer the question, I think that it's still in that stage of evolution, moving toward platform is what I'd say. Certainly, as we make investments, we're looking at things that integrate well.
Yeah, I think point solution fatigue is real. And it's from every aspect. It's from the payers, the providers, and the health consumers as well. You know, Haley, you talked about your parents. My mom was, you know, had to get a home blood pressure machine that had a little device that was supposed to send the readings off, and it never worked. And she's like, okay, now what do I do? You know, and then the blood pressure goes up and we're in this vicious cycle. But I do think that folks, especially now, because they're so taxed and really want a movement that is easy to adopt, because that's critical. Like, you can have the greatest solution, but if nobody adopts it, it's not the greatest solution. So I think it goes to platform plays. I think it goes to easy adoption, EMR integration, and all those things that make it a much more seamless experience for all the stakeholders.
Yeah, if I were to add on to that, Sally, you know, putting my old investment hat back on, what good is a product or technology if no one uses it? So aside from the exasperation of multiple point solutions and now, you know, having to download and manage 20 different healthcare apps, the point really is, from an investment standpoint, why would you back a company that has no volume, no adoption, no uptake? And that's the true, I think, KPI result that you're seeing. You know, what market sentiment is. We've already had, you know, 10 years of trying to see these digital solutions play out, and they just haven't. There's only a handful, I'd say, that has gotten real uptick in volume and utilization and engagement. And I think that's what I would be looking for as an investor.
Great. Well, we have about 10 minutes left and have a number of questions in the Q&A. So I'm going to shift over to that and ask a question, and then feel free to jump in as you see fit, and we'll have it more of a lightning round type of format, as Haley called it. So for the panel, one of the questions is, what is your view of next generation telemedicine? Anybody have thoughts on that?
I'm not sure I know what that term means. Maybe, I'm not sure.
I mean, our version of next gen telemedicine is that contiguous flow. So instead of just a transactional thing, there's an actual journey for the user that includes aftercare. So whatever follow-up is there, prescription, radiology, labs, that next best action is actually followed through. Again, that we already talked about the collaboration care team approach. So I think it's really more that ecosystem rather than just a doctor that's random in Alabama when you're in New York City. That's not going to fly anymore, and you're not getting the utilization anymore, obviously.
I would say the same. It's just how it's all going to fit seamlessly in and just be another tool as opposed to a big subject heading.
Great. So next question is, can you speak to medical device Internet of Things opportunities? Have you seen compelling opportunities within the subsector? And if so, how have prospective customers responded to the value proposition? This is medical device Internet of Things.
So this is an area that I've worked in before, so I'll jump in here. The fact of the matter is that RPM has great potential using IoT medical devices, whether they're consumer grade, which just still have some value, or they're medical grade. But if we go back to our earlier point that they cannot, if they're going to win and be meaningful, they cannot live in a vacuum. They cannot be a point solution. So they need to be integrated into the patient journey. They need to be integrated into how the providers are caring and the payers are paying in a way that allows everyone to collaborate and care for that patient. Right now, I think we're still, at least from the hospital to home or remote patient monitoring perspective, we're still very much in a way of working with these point solutions. I think it's a huge area of potential growth. But if you can't get the data that is coming off the telemetry that's coming off a device and get it into an EMR, right now, the state of the art is there's a dashboard for it, and there's another dashboard for that device, and there's a third, it can't scale that way. So I think the technology has proven that it works. We also need to think in terms of what are the models underlying to select those alerts, and making sure that our models and artificial intelligence are generating accurate results and all of that. Huge area of growth, but I think we're still have quite a bit to go to make it a reality in a meaningful way that really impacts the long-term patient journey. And I'd love to hear from Walter and Haley as well.
I think, Sally, your answer is going to be so much better than mine. I mean, I'm excited. There are companies out there. There's a company called Care AI, and the most interesting thing about it is it was described to me, if you compare Care AI to, let's call it, what's in the market today, Care AI, to a car with a backup camera, and you were super excited to have the backup camera, and this is great, and you don't have to look behind you, and it's wonderful. And then all of a sudden you have these autonomous vehicles that are having sensors and able to do so much more and drive themselves. And this is sort of Care AI. They're able to, with a very minimal amount of equipment, use a lot of data, use sensors to be able to really manage patients in a really meaningful way that should cut down. I mean, it should be able to make sure that patients are getting the care they need when they need it at the right intervals, and also that it can do things like predict falls, and it can alert caregivers to that kind of thing. That stuff's really great, and it does a decent job getting with the EMR and that kind of thing. I just feels like we've got great technology that's not quite sure how it's going to integrate with our systems yet, maybe.
Sounds good. The next question on here, what do you think of initiatives around social determinants of health and also incorporating environmental determinants of health into the fabric of healthcare? So I know social determinants of health was mentioned a little bit earlier today. I know to a certain extent, there's those programs that are incorporated in some of the things we've mentioned, but any additional thoughts around that as a specific target?
Who wants to go? I went first the last time, so somebody else go.
If there's no thoughts, I can move on. But
no, there are plenty of thoughts, I think.
I think there are plenty of thoughts as well. We've been looking at certain companies that do this and are still trying to figure out, particularly for the payer populations we work with, if it makes sense, and it's got to make sense for them at this point. I think there are great ones out there that are doing really good work in terms of identifying opportunities and connecting people with social services, social care. Aunt Bertha, which has undergone a name change, would be one of those. We have not made any investments that are specifically targeted at social determinants. We've looked at a number that are targeted at very specific populations of patients that would do wraparound services, but not necessarily under the heading of social determinants, but many of them are taking this into account as we look at them. And I think that that's, rather than being the main heading, it's sort of that part of the overall care that we're looking at delivering. Yeah,
we have a few companies in our portfolio that are working in that area, and it's incredibly important if we're going to improve the care that everyone gets and making sure that everyone gets the care they need. This is not a Microsoft startup, but one of my favorites is a company called Fabric, and they provide healthcare at laundromats. And it's such a cool way to provide care in a setting where people already go that may not have access to care. So anyway, just one of those that just tugged at your heartstrings and you wanted to go, yes, yes, please do that. Please continue.
Well, that's great. We're coming up on the top of the hour, so I'll just open up any final thoughts from the panel, anything that we didn't cover that you want to address briefly before we close.
I think the only thing that I would say is just keep innovating. We're gonna figure this out, and there's lots of great solutions out there, lots of innovative founders, and we love working with them. And some of these areas that still need to be solved, we'll solve them, but we'll only solve them together. So keep at it.
Great advice.
Yeah, I would say the same. I mean, healthcare is a really exciting place to be only because you can materially impact people's lives. And I think that's a really exciting place to be. There are a lot of questions in there on things like women-led companies and investment in women-led companies. Echo invests a little later stage, I think, for some of the founders that are maybe early on looking. But certainly we are a very diverse team of people, and we value diversity in our leadership, and definitely view that as a positive amongst the companies we invest in. Also, I think there are just so many things that technology is really opening up lately. And I think as we start to talk more platform, as we talk like Walter was talking about with what Pager does, keeping the consumer at the forefront, and like, how do we really make this easy for people? Because healthcare is not easy, and usually or often you're using it at a very personal and intense time of life.
Yeah, and I would echo that. I would challenge everyone to think big. I've always kind of advised, if you're going to make incremental changes, then you should expect incremental results. So there are a lot of problems to solve in healthcare, a lot. That's the easy thing, actually. The easy thing is to find something wrong with the healthcare system, and then it's actually very easy to solve that one particular problem, very easy. But to scale an operation that has a definitive impact on a community, healthcare ecosystem, from a healthcare macroeconomic policy perspective, the $4 trillion spend to make an impact on that at scale is extremely difficult in this healthcare system. So it's going to take big ideas and a lot of capital behind those big ideas and great people to affect the change. It's not going to happen, on its own from a germane perspective. So that's what I would challenge and encourage everyone to do, is to continue to think big and go big.
That's great. Well, I really want to thank the audience for hanging in there with us and listening to the presentation, and also for the excellent questions. I'm sorry we couldn't get to every one of them. If there are some that can be answered through the chat function, we'll certainly try to do that, but appreciate everybody's involvement in that. And I want to in particular thank the panel, Haley, Walter, Sally. Thank you for your time today and your attention, and thanks to the health crew for bringing this together. Thank you guys, and I hope everybody has a great rest of the afternoon.
Thank you.
Thanks, Mark. Thank you, Health.
Thank you to Mark and all of our speakers. Please visit our website at hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, November 13th through 16th for Health 2022.